Hello and welcome to Ask the Expert. From medical questions to questions about surgery or just debunking myths, there are numerous medical questions we've set out to answer for you. For the past several years, 7 News, in partnership with Bon Secours St. Francis, has been getting answers to your questions. From the simple questions like how to get better sleep to the more complicated ones concerning cancer and screenings. This is 7 News' Ask the Expert. Let's take a look.
From the head all the way down to the lower back, a neurosurgeon diagnoses and treats ailments related to the brain, the spine, and the peripheral nerve.
Everything that relates to the nervous system, which is basically the body's electrical part.
Dr. Samuel Asante, a neurosurgeon, says nervous system problems are very common.
It's actually one of the most leading causes of disability in the world.
He says there are several things that could land you in his office.
So when it comes to back pain, headaches, brain aneurysm, sometimes certain type of strokes. And also we deal with things when it comes to like Parkinson's, sciatica, pinched nerve, and just general back pain. We also do that. And also epilepsy.
Treatment is not always surgical.
We also do things like refer patients to physical therapy, chiropractor, acupuncture, exercise programs. There are multiple things that can be done, pain management and injections. So there's a lot that can be done before surgery.
If you are unsure whether you should see a neurosurgeon, Dr. Asante says these could be reasons to reach out.
I think whenever you have any issues, like you have weakness, you're not quite yourself, confusion, and you have like pain that is uncontrolled, you've tried everything else. And also when you start having issues like incontinence.
For this week's Ask the Expert, I'm Taylor Murray.
In her more than 70 years of life, Irene McMakin has faced a number of uphill battles, but she's not letting those stop her.
I have a pacemaker, and people don't realize that you can keep going no matter what. You know, otherwise, what's your alternative?
She's a prime example of aging well with a healthy mindset, no matter your circumstances.
Whether we're 1 or 100, we're always growing and life is always changing. So we need to find ways to accommodate the changes and still enjoy the hobbies and passions that we've always had, and maybe even create some new ones.
Susan Cannon works at Bon Secours' LifeWise program to focus on changes to mental, physical, and spiritual well-being as we get older. She says movement is especially important, including things like weight training, mobility, flexibility, and balance.
We encourage you to work your major muscle groups 2 to 3 times a week with a system that works with your level of fitness. Strengthening is so important for fall prevention, and it even helps with cognitive health.
The movement and physical maintenance doesn't strictly have to come from a weight room. There are other alternatives.
Besides walking, I have an exercise class I go to a couple of times a week. I work in my yard like 5 or 7 days a week. I eat healthy. I have stairs in my house, so I'm going up and down stairs all the time. So I think you really need to move. You know, even if you only can move a little bit, every day you can move a little bit more. It's good for you, it really is.
Nutrition also plays a big role, according to health experts.
Make sure that your older family member isn't just eating a can of soup for dinner.
And while physical health plays a key role in how our body ages, doctors say mental health is just as important.
It is shown that isolation is more dangerous for older adults than smoking. So we really need to stay active in our community, find things you enjoy doing, and pursue those hobbies and passions.
When asked how she's remained fit and maintained an overall healthy lifestyle, Irene McMakin laughed and said it's simple. Get up, get involved, and move.
I'd say get up. I don't care if you're just walking back and forth down your hall. Move. You've got to move.
For this week's Ask the Expert, I'm Kelsey O'Donnell.
I'm concerned about this.
Relieving your concerns and helping you get back on track after a cardiac event is a part of Hillary Joseph's job at Upstate Cardiology.
I primarily work inpatient in the hospital. I see patients when they come in during one of these crisis events, one of these cardiac events.
She's a part of a team of health experts that work directly with patients who suffered from heart attacks or failure, bypass surgeries, or even valve replacements.
Cardiac rehab expectations are threefold. One, you do physical exercise on treadmills, bikes, rowing machines. They do weight training, so things you would do in a typical gym. But then there's also the component of education by the dietitian for healthy diet and eating habits.
And that's when registered dietitians like Brianna Grand come in.
Our overall health and well-being really does revolve around a healthy diet and lifestyle.
As a cardiac rehab registered dietitian, Grand and a team of health experts at Bon Secours teach patients the importance of a healthy, well-rounded diet.
A healthy diet can prevent plaque formation. It can reduce your cholesterol and lower your blood pressure, which can also reduce the risk of future arterial blockages.
She says what you eat plays a big role in not only preventing cardiac events, but also how quickly you regain full strength afterwards.
To regain full strength can take some time.
Back at the rehab center, Joseph says health experts will work with patients as long as they are needed and noted that it may take less time if you stay on top of your symptoms.
We're really good at explaining our symptoms away. Oh, I just have a little heartburn. Oh, I might have pulled a muscle in my back. I'm just tired because I haven't been sleeping well. Oh, I had a little chest pain, but I ate something spicy. We can always explain away our symptoms, but when they recur and they happen over and over, it's time to go get checked out.
So if you think you have any of the symptoms Joseph mentioned, see a doctor because the steps you choose to take could be what your life depends on.
Patients who undergo cardiac rehab have 30% reduced risk of fatal heart events, as well as a 25% reduced risk of dying just from completing the cardiac rehab program.
For this week's Ask the Expert, I'm Kelsey O'Donnell. Remember, you can find all of these stories on our website, WSPA.com. Just click on the Ask the Experts section. Right now, we're going to take a quick break and return with answers to more of your medical questions. We want to continue now with a look at doctors and health experts answering your questions. This is 7 News Ask the Expert in partnership with Bon Secours St. Francis. Whether you're out grocery shopping, cleaning around the house, or competing in a sporting event, doctors say emergencies can happen to anyone, anywhere, at any time.
If you find yourself in an emergency, the first thing I would say is to try to stay calm, try not to panic, and to make sure you call 911 first.
Dr. Jay Blankenship has seen it all as an emergency medicine doctor. He says how you respond can often impact their response.
If you don't know how to respond to an emergency, the 911 operator and dispatcher often can give you advice and help coach you through the first steps to help provide care to the person who's in distress.
That's when CPR training, knowledge of AEDs, or even knowing how to use a tourniquet for serious bleeds will come in handy. Doctors say when bystanders help, your odds of making a full recovery increase.
Research suggests that out-of-hospital cardiac arrest survival rates with no bystander intervention is around 7 to 10%. However, when we see early intervention with CPR, those survival rates increase by around 40%, and research suggests that early defibrillation can increase survival rates by up to 70%.
Doctors say you should familiarize yourself with the Heimlich maneuver if someone begins choking and understand the signs of stroke. Think be fast.
We tell people to be fast. That's BEFAST, and that's an acronym that stands for balance, so acute change in balance. E stands for eyes, or acute loss of vision. F stands for face, or acute onset of facial droop. A stands for arm, or weakness in an arm or a leg. S stands for slurred speech, and T stands for time.
While things happen fast during emergency situations, medical professionals recommend trying your best to remember the steps you take, including the time and what happened leading up to the emergency.
You just never know when something like this is going to be a potentially life-saving knowledge. Could be for a family member, a friend, or even a complete stranger. But this training is extremely valuable and can truly make a big difference in someone's life.
For this week's Ask the Expert, I'm Kelsey O'Donnell. Doctors say women experience a wide range of changes throughout their life, mainly tied directly to their hormones.
Your ovaries are what produces estrogen, and as you enter your 30s and 40s, the estrogen actually fluctuates.
Dr. Kelly San Miguel with Bon Secours Carolina Women's Health has more than a decade of experience as an OBGYN. She's helped countless women navigate the physical and emotional changes associated with hormonal shifts and menopause.
When they actually go through menopause, then what happens is that estrogen stops completely, and if they go an entire calendar year without a period, then they're considered in menopause. It also kind of marks the time when they can stop having babies.
While menopause typically begins in a woman's 50s, doctors say hormonal changes can start much earlier, often in the 30 to 40 age range. According to medical professionals, pinpointing the exact start of menopause can be difficult. However, Dr. San Miguel says there are some common signs such as hot flashes, night sweats, and noticeable changes in the body.
You do not have to suffer. Being a woman is hard enough, having a baby is hard enough. When we're going through all these hormonal changes, there's definitely medicines that can help, but there are some risks.
The good news, doctors say there are treatment options available.
We first talk about lifestyle changes. So sometimes that doesn't include medications at all. That's doing things like dressing in layers if they have these hot flashes coming about, avoiding triggers, having like a fan, access to a fan. But then when we start talking about medications, and usually then I break it down between either hormonal management, so actually giving them back the hormones that their body is starting to have less of during menopause, or non-hormonal management. And we kind of talk about the risks and benefits. The most common non-hormonal is actually an antidepressant.
Doctors also emphasize the importance of physical activity, and in some cases, surgery or other therapies could be valuable options.
And then if you've never had a hysterectomy, so if you still have a uterus, you also have to have the progesterone back. And there's different ways we can do that. We can do it systemically, like as a pill or a patch, or we can do it kind of even as a spray or a gel or a ring. So there's lots of different ways of doing that.
But the most important first step is to talk to your OBGYN or primary care physician about the best option for you. For this week's Ask the Expert, I'm Kelsey O'Donnell.
There's always a risk and benefit to doing anything we do in life, and medicine is no different.
With nearly 25 years of experience, Bon Secours Medical Director of Primary Care, Dr. Steve Newman, has helped treat a number of patients.
It's estimated that over 50% of Americans over the age of 65 are currently on 5 or more medicines, and 13% of Americans under the age of 65 are currently taking 5 or more medicines.
Dr. Newman says the reality is many people will be prescribed some sort of medication during their lifetime. Some will need more than others.
Taking multiple medicines is not necessarily a bad thing.
While a lengthy list may be concerning to some, doctors say that's not always the case as long as there are direct lines of communication between you and your provider.
I think it's very important that we always look at what we're taking and make sure that what we're taking is appropriate and necessary. But just because you're on multiple medicines does not mean that your doctor's doing or provider is doing anything incorrectly, or that's not looking out for your best interest.
So, is there a limit on how many medications a person can take at once?
There is no number that's too much or too little, and the reason being is because you individualize the care of the patient based on what their current medical problems are. So it would be unfair for me to say that 8 medicines is too much, because in reality, if you have 8 medical problems that require medicines to treat those problems, 8's not enough. 8's just right, and 8's not too much.
Health experts say everything you take has potential for a side effect or bad reaction if you're not careful.
In other words, taking one medicine has its own risk factors. Taking 2 medicines has their own unique risk factors, but if the side effects are the same, there is theoretically an increase both in intensity and frequency of that side effect.
And remember, always review and look at your options with a health expert before taking more than one medication at a time. There could be other options that'll help you accomplish your same health goals. For this week's Ask the Expert, I'm Kelsey O'Donnell. Don't forget to submit a health topic to our Ask the Expert series. Go to our website, click the news tab, and look for Ask the Expert. It's simple. More of your questions answered by our Bon Secours St. Francis medical experts after this. Welcome back as we continue to get answers to your various health topics. We continue now with our partners at Bon Secours St. Francis. This is 7 News' Ask the Expert.
An estimated 1 million people get shingles each year in this country, according to the CDC.
Shingles are a viral infection that causes a painful rash.
Family nurse practitioner Ruthie Craps says shingles is caused by the varicella zoster virus, which causes chickenpox.
So we're exposed to chickenpox, and then once that chickenpox resolves and that initial infection is gone, that rash is gone, we don't shed that virus. It actually stays in our body.
That virus lies dormant, but in some people, it reactivates later. That's shingles. Crabb says 90% of adults 18 and older have had chickenpox, making shingles pretty common, but says it's more often seen in older adults.
Shingles typically is presenting due to some sort of stress or some sort of immune deficiency. So as we age, our immune systems get a little bit weaker, and so it predisposes us to that recurrence or reactivation of the virus.
Shingles is not contagious, but a person infected with shingles can still make someone else sick.
Here's the thing. You have a rash that comes up, right? It's going to be, it has some fluid. When that fluid is touched by somebody else, they can potentially, if they haven't been vaccinated for chickenpox or they've never had chickenpox, they can certainly develop chickenpox, but they wouldn't develop shingles.
Craps says it's important to take precautions to keep others safe if you have shingles.
If you have shingles, an active rash with fluid-filled blisters, you should really try to keep that covered. And if you do touch it, which you should try not to, if you touch it, you should wash your hands really well to avoid spreading those germs.
Shingles can be incredibly painful. Nurse Craps says the best way to protect yourself is to get the shingles vaccine.
So if you are 50 and above, you can get the 2-dose series of the shingles vaccine. It's about 97% effective in that age group, and then once you hit 70 years of age, it's about 91% effective.
If you are immunocompromised, your doctor may recommend the shingles vaccine at a younger age. For this week's Ask the Expert, I'm Taylor Murray.
It's the second most common form of cancer in the United States, and doctors say it's the deadliest.
About 1 in 5 cancer-related deaths in the United States is due to lung cancer. And that really is because of the fact that it is often found at an advanced stage, or it's diagnosed very late after it's spread locally or has metastasized or spread somewhere else.
Dr. Nathaniel Phillips has been studying pulmonology for several years and says lung cancer survival rates are strikingly different depending on when the disease is discovered.
Lung cancer screening and early detection can be the difference between life or death, really, for lung cancer. The difference between somebody that's diagnosed early on in the process, stage 1, most of those people survive. About 90% of those people will survive at 5 years. And versus stage 4, when it's caught more often, about 10% of those people will survive at 5 years.
So how can we improve these odds? Doctors say early detection through annual screenings is key.
Every year. Similar to breast cancer, where people will get a mammogram once a year in screening, that low-dose CT scan is the way that we screen for lung cancer. And anyone 50 years or older that has smoking history should absolutely get screened.
Despite the importance of screenings, health experts say lung cancer often goes undetected until it's in advanced stages because the symptoms can be subtle.
The reason that it's often caught late is because people will not have symptoms related to lung cancer. And when they have symptoms, it typically would be non-specific symptoms. So things like a cough or chest pain, weight loss are the most common.
Risk factors for this type of cancer are well known, with smoking being by far the largest contributor. However, health experts say other risk factors include family history and environmental exposure.
In patients that have a history of wood-burning stoves or things used to heat, any smoke exposure, not just smoking, but smoke exposure in general, that's a risk factor.
The message is clear. If you're at risk, doctors say to get screened regularly. It could be the difference between a successful treatment and a late-stage diagnosis.
We really want to catch this early so that we can treat and diagnose it when we can make a bigger difference for the patients.
For this week's Ask the Expert, I'm Kelsey O'Donnell. Focusing on the needs of others. It's a trait health experts say many people pleasers take too far.
It's like essentially like a behavioral pattern in which individuals will just prioritize the needs of others over themselves.
Bon Secours behavioral health therapist Justin Plant says when your mental or physical health begins to suffer, it's time to shift focus from helping others to helping yourself.
If you're always kind of overextending yourself for the needs of others, we can have increases in irritability and fatigue, sleep disturbances, as well as a lot of times folks with people pleasing will experience excessive guilt and anxiety around needing to continue to prioritize the welfare of others over themselves.
Doctors say most excessive people pleasers may not even notice the harm their actions and behaviors are causing. Health experts say it can lead to resentment and an unhealthy dependency on people, essentially putting your mood and how you live in the hands of others.
It's good to kind of analyze where's all that energy going, and if it appears it's going into kind of always planning and moving your life and your daily schedule and responsibilities around those of others to a large extent, then you could be people pleasing. And also is looking for those symptoms of burnout that accompany it.
People pleasing is all around us, in your social life, within your family, even at work. But how did we get here?
And usually is an interpersonal type of trauma that creates people pleasing.
Plant says it's a behavior that can form for a number of reasons, but one of the most common has to do with past traumas, riddled with a deep-rooted fear of abandonment. But the good news, doctors say you can heal your people-pleasing tendencies by setting boundaries. Doctors say that includes your ability to say no and understanding your self-worth.
The best thing to remember is boundaries are for you, and it's not for the other person. So they may not understand the purpose of it, and that's okay.
For this week's Ask the Expert, I'm Kelsey O'Donnell. That's a wrap on this week's Ask the Expert show here on WSPA Plus. Join us every Thursday on 7 News as we seek answers to your top health questions, and each week right here on WSPA Plus. For now, thank you for making an appointment with us today.